Hi, I'm Dr. Ranj Singh and I'm an NHS children's doctor. I'm here to tell you about sepsis. Sepsis is a rare but potentially deadly reaction to infection, where the immune system goes into overdrive and begins to cause harm. If your child under the age of 5 is unwell with a bug or infection, watch them closely. The following symptoms may be signs of sepsis. Go to A&E straight away or call 999 if your child looks mottled, bluish or pale. They're very lethargic or difficult to wake. They feel abnormally cold to touch. They have a rash that doesn't fade when you press it, and remember to keep checking rashes as they can change. Or they have a fit or convulsion. Other signs to look for are if they're finding it harder to breathe, they're making grunting noises with every breath, they're breathing very fast, or if your child can normally talk but they're now unable to say more than a few words at once, and equally call if their breathing obviously pauses. They're vomiting green, bloody or black vomit. They cannot be encouraged to show interest in anything. They've become floppy, they're not responding or are very irritable. You feel the soft spot or fontanelle on your baby's head is bulging. There's weak, whining or continuous crying in a younger child. Any older child who's confused or has neck stiffness and finds it difficult to put their chin on their chest. Call 111 for urgent advice if you see any of the following potential signs of sepsis. They've not drunk for more than 8 hours whilst awake, have not had a wee or wet nappy in the last 12 hours, their eyes look sunken, or if your baby under 1 month old has no interest in feeding. For babies under 3 months, any temperature over 38 degrees centigrade. For babies between 3 and 6 months old, any temperature over 39 degrees centigrade. For children over the age of 6 months, the height of their temperature is not always the best indicator of how unwell they are. Instead, healthcare professionals will look for other signs and symptoms. The following features of temperature are concerning in a baby or child of any age. A high temperature that lasts more than 5 days. A temperature under 36 degrees centigrade. Low temperatures should be checked 3 times in 10 minutes. And if you feel your child is more unwell, you're more worried than when you previously sought advice, or you're concerned you're unable to look after them. Remember, sepsis can develop quickly, so even if your child has been seen and sent home by a healthcare professional, keep an eye on them. If you're worried that they're getting worse or they're sicker than you might expect, act quickly. You know your child best, so trust your instincts. If you see something you're worried about, speak to a healthcare professional and ask, could this be sepsis? And remember, go to A&E or call 999 if you see any of these warning signs. Or call 111 for urgent medical advice if you see any of the following. For further information on sepsis, visit nhs.uk/sepsis.